Good morning, everybody. Welcome. Just going to give it one more minute just to make sure that we've got everybody here. And thank you, for taking the time to come and join us this morning. Really hoping that this is going to be a really super informative session for you all as we talk about what makes an NHS nurse. What does an NHS nurse look like? I can just see some more people are joining, so I'm just going to give that a couple more minutes. Okay. I think we have everybody. So this is going to be a recorded session. So if anybody does need to leave, we will be posting this into the Facebook group and onto our YouTube channel. So it will be available for replay. So for anybody who hasn't met me yet or who doesn't know who I am, my name is Shaunard. I'm one of the recruitment specialists at Northern Lincolnshire and Goole NHS Foundation Trust. And joining me today, we have our practitioner Trish McKenna. We have Carl Paradella, who supports our nurses who are in practice. So once they've gone through all of their OSCE training and they're out onto the wards, Carl does all of their support. And then we also have Michael Sani, who is with us. Michael helps all of our international nurses through their OSCE training. So they can sort of introduce themselves in a lot more detail shortly. So the purpose of today, it really is just about giving you an awful lot more information than you can get, online on the NMC website, in our recruitment brochure. And it's really just so that you get a bit more of a feel for who we are, put some faces to some names, and just sort of it feels a bit more human, I guess. And also you get to sort of see, where you might want to be joining, who the people are and what sort of a hospital we are. So we really appreciate your time. And we know that, you are right now going through probably the NMC registration process. You'll be working really hard to get your IELTS, your OET. Some of you may already have that. And you are in demand, as an international nurse who is ready to be deployed to the UK. I'm sure you're considering lots of hospital trusts. So really what we wanted to do was to give you that engagement with us and an opportunity to really find out a lot more about maybe some of those things that you don't know yet. What does a nurse being in the NHS involve? Like I've mentioned before, it's things like, what does nurse-led care look like? Because, in certain countries, rather, it might be doctor-led, and there's a lot of variations there. As the NHS, we're more preventative. So Trish is going to talk to you about, what does proactive nursing versus reactive nursing look like? Michael's going to talk to you about the challenges that that some of the international nurses that have joined us, what the challenges that they're facing currently, during their OSCE. And then Carl can talk to you a little bit more about, what are the levels of autonomy in the role as a nurse. For some of you in certain countries, it might be that you take full direction and instruction from doctors, whereas here it might be that we take the reins as a nurse, and you're kind of given that level of autonomy to make those decisions here. And also is going to cover some of the maybe more of the unknown duties, things that you wasn't aware that nurses actually do here in the UK. So once they've gone through all of that, we will open up for a Q&A at the end. So you'll be able to put any questions that you have into the chat box, and then we'll read them out and we'll go from there. So yeah, I think that's everything from my side. So I'll pass you over to Trish, and yeah, we'll go from there.
Good morning, everybody. I'm Patricia McKenna, and I am the Trust Practice Development Lead for International Recruitment. So my job is to look after you guys from when you come into the country and to support you through the OSCE process and gaining your NHS registration with the NMC. And then when you go out into practice as well. So my job doesn't stop after you've got your PIN. That's when we have people like Carl that go out and work on the wards with you and help develop you right the way through your career. So when you're in a position where you want to start moving forward, progressing, looking at different educational courses, things like that, our team support you through that as well. I know that for internationally educated nurses, education is one of the main reasons why you want to come to the UK. So we offer quite a good education programme that helps develop you throughout your career. So our job is quite wide-ranging. But firstly, the first question is, what does an NHS nurse look like? And that's a really difficult question to answer, because we don't just have one form of nursing in the UK. We have so many different avenues and for you to go down. We have a lot of specialist nurses in the UK. So for most things, we will have specialist nurses. We have things like specialist respiratory nurses, specialist cardiac nurses, but we also have a lot of specialities that you might not have come across before. So, for example, we have specialist dementia nurses, learning difficulties, mental health nurses. So we don't just have a general nurse that's qualified in everything. We have separate nurses for mental health, separate nurses for general nursing. Midwifery is a separate branch of nursing as well in the UK. So it's very hard to narrow down what an NHS nurse looks like, because it's what you make it. It's what you want it to be. So, for example, when you first come into the country, you might be deployed to a medical ward. And that would be where you would work while you're gaining them core skills in nursing. So while you're being trained in your venipuncture, your cannulation, your catheterization, and just regaining them core skills. But then it's the time for you to think about, what do I want myself as an NHS nurse to look like? And that's when we start to branch out. So because of that, the NHS is a very nurse-driven organisation. So yes, we have doctors, and yes, our doctors make our plans of care, and our doctors are very respected, but our nurses are very respected as well. So our nurses are very involved in the planning of care for our patients. So we are the first line of defence. So if a patient's deteriorating or a patient is unwell, it is up to us to recognise that. We lead for our patients, we advocate for our patients. So if the doctor asks us to do something and we don't agree with it, we challenge that. So it's very much nurse-led in that way. And because we have so many different specialities of nursing, often they are more educated, wouldn't you say, in a lot of the areas than some of the doctors are, because they've had that time to really specialise in themselves. So as a UK nurse, it's a very, very respected career, and it can be what you make of it. Feedback that we've had from other internationally educated nurses is that sometimes when they're expected to do medication rounds, observations on the patients and follow the doctor's plans, we do that to a certain extent. However, we have a little bit more say and autonomy about what happens with our patients, but I'll let Carl speak about autonomy later on. The other element to the NHS and being an NHS nurse that you might not be aware of is how proactive we are in our nursing. So the NHS is free at the point of contact. So anybody in the UK can go to the NHS, can go to A&E, can go to their GP, regardless of their income, and they can get help, and they will not get charged for that help. So because of that, we like to prevent things from happening before they happen. So we tend to get involved a lot quicker. So we have really good community services. We tend to admit people into hospital for reasons that maybe in your own countries before you came here might not get admitted. So we will admit people for things like chest infections, and we will treat them for that chest infection. Whereas from what some of our other nurses have said, it might be more like they would be admitted for pneumonia, or we would admit people for if they've got any sort of chest pain or anything like that. We're a very proactive institution. And that can also go along with things like health equality. So we put a lot of service and funding into things like smoking, alcohol reduction, and all them things that would stop people becoming poorly in the first place. We have a very good relationship with our social services. So if somebody is, for example, becoming constantly getting a chest infection because they live in a damp house, we would involve social services and the local council to try and get them moved to somewhere more suitable. So that's what I mean by proactive. Sometimes we have to be reactive. So I'm not saying we don't have people that come to the hospital when they've had a myocardial infarction or come to the hospital in kidney failure, and we do have to be reactive, but where as possible, it is a proactive institution. And because of that, you're expected to notice these things. So you're expected to be, as a practitioner, to notice if your patient is smoking 20 cigarettes a day and refer them for help when they're needed. As a practitioner, you're expected to notice if somebody's observation, as a nurse, not as the doctor, you're expected to notice if those patients' observations are starting to become a bit deranged and give recommendations on how to treat that patient. So it can be a very different way of working. And yes, it can be harder, but it can also be very, very rewarding. And it's also, you will also be given the respect that's deserved from that. And we also offer a lot of opportunities in regards to promotion and development that a lot of the other countries don't have. So you come in as a staff nurse, that would be your role as you when you first come in, just because you haven't had the experience in this country to be a higher level nurse, but that scale will only go up. So you might start off on there, and that's reflected in pay and benefits as well, might I add. So you start at one level, but the more experience you get in the NHS, your standing will only go up. So it's very much what you make of it, really, when you come here. Just to talk about NLAG as a trust, the differences with NLAG as a trust. We've just recently won the Pastoral Care Award from NHS England because of the support that we give you in regards to everything else. So that starts right the way from Shonad and the recruitment process to Laura, who helps you with your visas and everything else, all the way down to the care that we provide and the support we give you throughout your career. So please be rest assured that this is a guided process, and you will be guided through OSCE, and learning how to be that autonomous practitioner and that proactive nurse is also guided by Carl as well throughout the ward experience. So yeah, I'll hand you over to Carl now just to talk a little bit more about that autonomy and just what that means and the differences from what you might experience when you're is that okay,
Yeah,
Carl? You want to introduce yourself?
hello. So my name is Carl. I'm one of the practice development nurse. My role is basically supporting international nurses and also newly qualified nurses who is in the wards already. So I'll be seeing you guys in the wards, and I try to support as much as I can. Okay. And just to add up with what Trish said with regards to NLAG, NLAG is really, really supportive with regards to international nurses. Because I myself was one of the international nurses as well. And when I came here, I was really hesitant to travel alone because I haven't had an experience of traveling alone, and it was really scary. Yeah, but because of NLAG and because of Laura Standland, who's doing that time doing the process of bringing us here. I had a very very smooth experience um with traveling and with and settling in as well, because even when I came here, even after that they were still very supportive. Now, moving on, with regards to the nurse's role, the nurse's role here in the UK, in the NHS is really quite different from where we came from what countries we came from, because the nurses here in the UK is very very autonomous, meaning to say that we can actually make some clinical decisions on our patients, and we don't normally ask or just wait for the doctors to step in and see the patients. One example for that one is that if the patient is if you see your patient is deteriorating, we normally, as nurses, we normally have to step in and make sure we have done our part as well as nurses. Unlike in other countries wherein if we see deteriorating patients, we normally just call immediately the doctor and inform that the patient is deteriorating, and normally we have to wait for the patient, which would actually delay the treatment. A good example for that one is giving patients oxygen, which is a very good example. For us nurses, yeah, we can actually give oxygen up to an extent, as an initial treatment. Also with IV fluids, we are actually allowed to give some IV fluids up to an extent, especially like for patients who are actually you feel that dehydrated or the blood pressure is a bit low. So to for us not to wait for the doctor, because doctors might come late, for us not to wait, then we normally can step in and do give IV fluids as nurses. Um, Also with regards to medications, there are instances in other countries as well where in fact patients are complaining of pain, patients complaining of nausea or vomiting. And in my experience alone, when I was working outside of UK, we normally just call the doctor, ask for the doctor to have some medications for pain, give some medications for nausea, and it would take like 30 minutes, would take 1 hour, or even it would take like 4 days of not 4 days, 4 hours. 4 days is too much. 4 hours. And even the patient will like complain a lot, or sometimes even the patient will not complain because the pain has gone already and we haven't done anything. But here in the UK, because we are autonomous, we are actually allowed to give a certain amount or sit and give some medications like paracetamol, for example. We are allowed to actually give the medication immediately, even without giving or waiting for the doctor, or waiting for the doctor's order for that one. So we are it's really quite different based on my experience working outside of the UK, because I was too very dependent with the doctors. But when I came here in the UK, I've learned that the nurse's role is really, really like wide, wide to the point where, and actually I can actually decide on my own and check on the patients that I'm taking care of. That I can do something outside of the doctor's order. What else did I miss something?
As prescribers, we can have.
Yeah, nurse as well. Earlier we can have there's a lot of nurses roles as well. We can be nurse prescribers, but we need to have a training as well for that one. Um, with regards to some working as a nurse in the NHS, there are certain roles or duties that might not be familiar to you guys. Like for example, patients having bed baths. Not all of us are doing bed baths in our own home country. Because I think because it's more of a cultural thing, because most of our countries like Philippines, Nigeria, Asian countries or African countries, we are likely family oriented, and normally doing bed baths is not a nurse's thing, or not even like an HCA role, but rather it's more of a family role. So in our countries, families usually do bed baths to their patients, but here in the UK it's quite different. It's not just nurses that's doing the bed baths, but also the HCAs, or the healthcare assistants as well. Another example for unknown duties would be 12-hour shifts. So here in the UK, normally nurses working in the wards, they usually work on a 12-hour shift. And also let me add on that one as well. When Because in our countries, from where we came from, handovers are not actually handovers, or we simply say it like endorsements. We don't normally count it as in time. So when we, let's say for example, in our countries, when we work like 8 hours, like 8 o'clock to 4 o'clock, after 4 o'clock we do handovers. So it will actually extend the time, but we're not paid for that one. But here in the UK, we have a 30-minute time for us to do the handover, which is still covered with our work. Okay. Also, with regards to uh getting bloods, or getting blood samples, nurses here in the UK are actually allowed to do that. When I was working in my home country, which is the Philippines, I wasn't actually had the experience. I hadn't had the experience of getting bloods, because we do have a phlebotomist all throughout the day. So if we need bloods, we can just call the lab, and then someone will try to get it and just get the bloods. But here in the UK, because we are autonomous, we are actually allowed to do it. But we need to have a training for that one as well. Everything that we do here in the UK, we have a training, and we need to be competent enough. Starting from giving medications, IV cannulation, even though we are already fully trained in our home country, but because we are working here in the UK, so we have to follow their protocol as well, and their policies. That's why we need to be competent before doing that thing. And I think, did I miss something?
No, I think you've done.
Yeah. So I think I've covered everything.
It will, I think, the thing is, it will be a different way of nursing to what you're used to, and there's no getting around that. It will be very different to what you're used to. However, it will also be very satisfying, and you will have us there to guide you every single step of the way. So it's not like we will just throw you out there. You won't do any of the skills until you're classed, like Carl said, as
Yeah.
competent in doing the skills. But I'm just going to bring Michael in now and let him introduce himself, and he's just going to talk about some of the issues that have been faced recently by some of our internationally educated nurses. Yeah, and a bit about how you speak up if you do face any issues and escalation. Is that okay, Michael?
Good morning, everybody. My name is Michael. I'm one of the practice development nurses, and I'm basically in charge of helping you pass OSCE when you eventually join us. We hope you will join us at some point. Um, so basically, I'm just going to run through some of the challenges faced by internationally educated nurses like ourselves, and particularly things that I've seen through the process of OSCE and the early stages of practice on the wards. But I think number one on the list is the cultural shock. There are things that we do from wherever we've come from that if you do them here, they seem very rude or a bit rude. Like we had a discussion this morning about using certain adjectives to qualify people. We might, in our home countries, those things might have been like a normal conversation or you having a chat with a friend. or a colleague. But if you use those adjectives, yeah, they come across as being rude. So cultural shock or cultural differences is a thing that a lot of our nurses have found hard to, maneuver and adapt themselves to. So it could be something as little as you might not like where a lot of us have come from. I'm particular about Asian communities and African communities. You we're big on respect. Take for instance, your ward manager works on the ward. But I'm saying it from a Nigerian perspective now. It's a belief or it's expected of you as a nurse, as a junior nurse, to stand up for your manager when she walks onto the ward. But yeah, it's not really a thing. Like, and there's also that bit of you having to call everybody Sars and Maz. Yeah, you address people by their first name. And it doesn't take away the respect. I think it's just a perspective of how you go about your business with everybody in the most respectful way possible. And we all know the trust is big on respect as well. So you have to accord everybody the respect they deserve. And calling them SARS or not calling them SARS or Mars doesn't mean or doesn't take away that respect from them. Then another thing I have written on my list would be the shift type. So I'm sure that a lot of us are used to working 8 hours, or for some people, you get to work a core shift, which is working 24 hours. But yeah, we have just two types of okay, now I would say two. We have three types of shifts. We have the long days, which is usually your day shift, which is from 7 a.m. till 7:30 p.m. Then the long night, 7:30 p.m. till 7 a.m. the next day. Then you have your early and your late shift, 7:30 till 2:30 and 2:30 till 7:30 p.m. at night. So because most of us are used to working 8 hours, coming into a system where you're working 12 hours could be very overwhelming for you. So what and we've also realized that that's like one of the major challenges people face when they come across. I had a friend that on our first day, this person was sick all through the day. Like she kept popping into the toilet because the work was overwhelming for her. So I think it's one of the challenges you should expect to face. Then I also one of the other things is the process of transition from your home country to the UK could seem like a daunting task. And honestly, I'm saying it from a place of experience that it can get overwhelming sometimes. Like, you're like, oh God, why have I made this move? Who's asked me to do this? But at the end of the day, be rest assured that you have a team around you that is ready to support you whenever you feel that way. It's our job to make sure that your assimilation into the trust and your assimilation into the trust goes as seamless as we can help you make it be. Then there's also the part of people having too much expectations. Take for instance, you'd expect some people, not all everybody now, some people would expect certain things from us. And those things are extremely unattainable because maybe someone has said, oh, when I came, I was given a car, I was given something, and you don't ask the context in which this person got what they got at the time. And you're coming in with the expectation of, oh, I should get a car when I come in, I should get this, I should get that. But honestly, no. We're here to make sure that you have everything you need, but do not expect us to go overboard. We'll provide you with every resources, everything you need to make sure that your stay with us and is as easy as it gets. And we'll also make sure that we're there to support you in whatever way we need to. But please and please and please manage your expectations. Manage your expectations, right? Don't put too much burden on yourself. I'll give another example. Somebody might have decided to convert the salary scale, but I've just done it literally like, oh, I should be earning about £3,000 a month without factoring in a lot of other things like your taxes and every other thing that comes with it, without factoring all of that in. And you get your first pay and you're like, oh, is this how much I'm going to get? Because you've had so much expectation of what you're expected to earn, you get very disappointed when you eventually see what you're actually going to earn at the end of the month. So please and please and please manage your expectations right. There's also something that for me, it's a personal thing that whenever I get new nurses coming to prepare them for OSCE, I say it to them all the time. It's your settlement period. Now, I'm sure some of you might be married, some of you have kids, some of you have families that you are eager to bring across with you when you're coming. I am begging you, if you have a way to delay that, please do. We're saying it because we have seen people struggle with bringing their family across. You're in OSCE training with me, and everybody on the team knows that I am not the most I will not go soft on you. I would push you till I make sure that we're on the same page as regards where we need you to be for OSCE. And imagine having to go through that stress every day for about 1 month. You have to go through the stress of going to write the OSCE, and peradventure something goes wrong in your exam, you didn't pass. You'd have to go for a receipt in about 3 weeks. That's taking about 2 months away of the 3 months that we expect you to use to initially settle on the ward. It leaves you with 1 month. The 1 month you would be working supernumerary on the wards. The 1 month your pain would come. At the end of the 1 month, you literally be in the numbers on the wards. You literally start practicing as an actual nurse on the wards. That first 3 months can be overwhelming and challenging. So I beg of you, if it's possible, please give yourself time. Give yourself about 3, 4. Honestly, I would say give yourself about 6 months. Because by the end of your 6th month, you're very settled, you know where to go to, you know who to turn to if you need something, you know who to ask for help. You would have gotten a proper accommodation for your family. We had a nurse about 2 cohorts ago who at every time, even in OSCE classes, she was always bothered about bringing her children across. And till date, she's still struggling because she didn't give herself that time to settle. So if it's possible, I know it's not easy to be away from families and your kids and your loved ones, but please and please, if it's possible, it's just see it as um a period that everybody needs to endure. Just try to enjoy that period, because if you bring your families across and you get overwhelmed in the process, honestly speaking, there's little or nothing we can do to support you at the time, because we cannot mingle or get involved with things involving your family. You are a priority, and as your family is your priority. So all we can do is help you to settle in on the wards in the country and make you the best nurse the trust deserves, or the best nurse you can be. But please and please, it's a plea. It's something that I take very personal. That I beg people all the time. Try and give yourself time to settle. don't rush it. I know it's a big deal. Your family you want your family to be with you. Honestly, I know that for some people, their family is their biggest source of support. But at the same time, would it do you any favor or any help if your family comes in and you begin to get overwhelmed with the whole thing? So, the last one. The last one would be the OSCE process.
Do you mind if I just quickly come in on what you were
Yeah.
saying, please, Michael?
Yes,
I
please.
think if I could pick one thing for you to take away from this conversation, it would be that seriously consider before bringing your children and your loved ones to the UK. Wait till you've got your PIN, wait till you've got accommodation for your family, and wait till you're settled, because the nurses that struggle the most in OSCE, and we know this statistically through pass rates, are the nurses that have got children that they're trying to settle into the UK, as well. And if there's one thing I'd like to take away, where the majority of people's issues come when they're in the UK, it is that. And when you come, you're building this for your family, so you need to get off on the right start. Sorry to interrupt, Michael. I just wanted to agree with you there.
Yeah. The last one would be what we expect of you through the OSCE process. Like I say to everybody on the first day when they come in class, I say to them that you're already nurses in your own rights. You are expected to be able to motivate yourselves. You're expected to we are expected to have the right attitude to the entire process. Now, some people would expect you to spoon feed them through the process. But honestly, nah, we don't do that here. I don't do that. Others do it, but I don't do it because I think that you know these things. It's just to fine-tune what you know into what is expected of us. So yeah, obviously we'll always have a laugh about everything and all of that, but when we are working, I'd expect everybody to put in their best foot forward. Like, let's get this done and forget about it as soon as we can. The aim is be in OSCE class for about a month, and at the end of the 1 month, you take your exam, you pass, and we say goodbye to you. I say goodbye to you. Hal would always be there to support you on the word. But personally, I just
We
want you
don't
to
say
come
goodbye
through.
to you, Michael does.
I just want you to come through and get the exam done, and let's forget about you stressing about OSCE, because honestly, OSCE is stressful. The thought of having to study for about 21 stations, it's a lot. It can get overwhelming at times, but one thing I can assure you is we're here to provide everything you need. I mean, literally everything you need to pass the exam and get through with it as soon as possible. So that should be all.
Thank you. But I think that we have painted a very rich picture, but a very real picture. And without putting anybody off, I think, we just wanted to really highlight to you some of the things that, I think people see this as a bit of a dream, a move to the UK to become a nurse. And it is a dream, but it's also very hard work. And a lot of preparation has to go into it from both sides, so like Michael said, it's about managing your expectations. And like Trish also highlighted, it is worth it. It is so rewarding, but without getting lost in the dream of I'm going to become a nurse and I'm going to move to the UK. This is also about, you are here to do, a really serious job. We need to make sure you are safe. Michael is here to make sure that you're not distracted during that OSCE prep, so that, if you're not bringing your family over and you're not stressing about finding schools, finding nurseries, getting accommodation, where is your next, are you moving out of the flat and moving into somewhere else? If you've got all that going on as well as preparing for an exam that is going to give you your UK registration, it's probably going to be too much for you. So I think he painted a really, really clear picture there, which, you know, again, doesn't always, it gets lost in translation during that recruitment process. So I think that you touched on some really, really key things. Something I did just want to touch on is the, you know, the 12-hour days, these long shifts that Michael spoke about. Now, that's not to say it's not 7 days a week of 12-hour shifts. It's, how many days is it? Is it 3 days? How many days would you do of a 12-hour shift before you have your off days?
Yep.
37.5.
It's normally like
hours.
three days per week, but sometimes it goes to 4 just to catch up with the 37.5 per week.
Yeah.
You only
yeah.
work 37.5 hours a week.
So if you have those 3 to 4 days of 12 hours, what would that follow with days off? Couldn't see your hand there because of the
So how it's supposed to work, it's done on a rota over a 3-month period. How it's supposed to work is you work 3 days a week and then you have 4 off. But it also, we've got to bear in mind the demands of the ward. So we don't break working time directive at all unless people opt out of that. But it's usually 3 days and then 4 off, then maybe 4 days, 3 off to make up them little extra hours.
Also, I'll just add on to that one as well, because some of the international nurses have problems, are looking like, why do I have like this kind of shifts? That 3 days off does not mean that you will have a continuous 3 days off. So that 3 days might be broken into like days within that week, and also that 4 days off as well. Because I've been communicating with a lot of international nurses, and then they're actually like trying to complain about their shifts, like where is my 4 days off? Why do I have like 4 days shifts? So it really actually is adjusted as per the needs of the wards as well. So let's say, for example, if your shift for this like week will be like very tight, most likely your shifts for the next week will be much lighter compared to the
Yeah.
previous week.
So it's so we tend to more do it in hours as opposed to shifts. So it's 37.5 hours. And that's spread over a 3-month rota. But then and I know we're trying to be realistic, but can I just say a couple of the highlights from with that? So benefits from the trust, obviously, if you work on like a Saturday or a night shift, you get extra pay. If you work a Sunday, you get extra pay. We've got quite good annual leave as well, so you can take annual leave for that group of time off if you need it. And we also have 4 days per month that we can request either not to work or work. So say, for example, one of your children might have a sports day and you knew you didn't want to work on that particular Monday, you wouldn't necessarily have to do annual leave. You could request it.
A carer's leave.
Yeah. Oh, we have carers leave. We've got very strong policies on family commitments in the trust. So we're very supportive with families and things like that. And what I used to do, and I'm going to be honest with you, if it was Christmas coming up or things like that, I'd request to work a Sunday. Because if I requested to work a Sunday, I'd get a little bit more in my pay packet. So the main thing about your rota, it's about having those open communications with your manager, but you will not be expected to work anything over your contracted hours with, unless it's agreed by yourself. So you have to agree to it first and foremost, and you'll be paid, compensated for that work as well. Did that make sense?
Yes.
Yeah. Well, actually, I was going to mention that because I know when Michael was speaking, he mentioned about the taxes, the tax deductions from your salary. So again, it was about managing expectations of that first salary packet and what does that look like. And sometimes you might, he kind of alluded to it, you might get less than what you first thought. But what I wanted to touch on was those salary enhancements. And I think that, the extra 4 shift pay, the weekend work, the night shifts, I think that certainly is a massive bonus, isn't it, to get those salary enhancements. So yes, we do have tax, but as a nurse working shifts, there's an awful lot of enhancements and benefits as well.
I'll be honest with you, Shaunad, when I was a band 5 staff nurse as newly qualified, sometimes I picked up more per month than I do now because I only work Monday to Friday. So
Yeah.
because of those enhancements for my night shifts and things, I mean, I don't know if you found the same, even though I'm a higher grade now and higher paid now, because of those enhancements, did
Yeah.
you find the same?
Yeah.
Yeah.
Yeah. But I think as well, you know, and this obviously this is kind of detracting away a little bit from what the topic was about, but the fact that we've actually got, you know, Carl and Michael, who have been with us, what, 2 years, you know, joined us as an international nurse, and that they now themselves are, you know, it's gone full circle. So the career progression opportunities, I think, it just shows, you know, that those we've got fantastic career progression opportunities for anybody who wants it.
Could I just add something to that really quickly, if you don't mind? So in regards to career progression. So one thing I found personally as an English nurse that's worked a lot with internationally educated nurses, when you first come to the country and you've got all these different things to learn, it can seem quite daunting. But those core skills, that experience in nursing, that hasn't gone away. So yes, you can feel a bit like you're stagnating when you first come in and you're learning the paperwork and the procedures and things like that. But then once that clicks in, you will skyrocket. And personally, now I know as our team, we've employed into senior nurse positions a lot of internationally educated nurses because of the experience and the wealth of knowledge that you guys bring with you. So we've got Carl, we've got Michael, but we've got other members of our team as well that are internationally educated because we appreciate the experience that you're bringing.
Yeah. And I think as well, something I just wanted to touch on before we do open out to a Q&A. Again, you know, we have highlighted that it is a challenge not having your family, because, you know, the first thing that you want to do is you want to bring your family over and get them settled as well. But like we've sort of said, that whilst you're going through that OSCE, it is really important to just have that time to dedicate on yourself, to get yourself settled, get yourself learning your OSCE, get it passed. However, what I think I will say is that, you know, speaking to a lot of the international nurses who have joined us, what would you say that the sense of community is like when you come over with a cohort? You know, you're living with, you know, a group of other nurses who are also in the same boat. You've all moved together. So even though you don't have your immediate family, what would you say it feels like for you having come over without family, but having that sense of sort of work family to support you during that time?
I think
Michael?
for me, I was one of the lucky few because I came across with one of my friends from uni.
Oh, wow.
So, and we literally stayed in the same house, and it was easier because I've known the person for a while, and you know. But one other thing is everybody that came in my cohort, we were all there to look out for ourselves. We're all there to support ourselves, and wherever anybody was, struggling, if the person wasn't willing to to speak up, we took it upon ourselves to speak up and get them the support they need.
Yeah. I think that's another thing, isn't it? Is one of the challenges I think that's faced with many of the international nurses that join us. It's that knowing how to challenge and how to speak up. Because I think in certain cultures, I think challenging superiors, or, you know, speaking out when you don't think something's quite right, or if you've got a personal issue, maybe for some it's, you know, it can be an issue. So I think, you know, touching on that is quite important, knowing that you can actually speak up.
Yeah, just to add on that one, to speak up as well, because when when we were back in our home countries, when we tried to speak up, especially to our superiors, it would actually be taken against us. But here in the UK is much very different because we are treated fairly. So when we try to speak up, it will not be taken against us, but it will be like a lesson for everyone. um because it happened to me as well. I tried to speak up and I was really hesitant, because I was brought up in a country where I wasn't able to actually speak up for myself. But when I was in the UK, I was able to gain that confidence in speaking up for myself and standing up for that.
Yeah, yeah. And I think for anybody who's yet to go through the interview process, just take that, that's a big takeaway from today as well, because, in some of your questions, it will be about, how might you challenge? How might you, or if you see something that you don't think is right. So that's something again that we really encourage you as an NHS nurse, is to really sort of speak up when there's things that you don't feel is maybe quite right. So we're going to open this out now to the chat. Your microphones are all disabled, so you're not going to be able to speak out loud on this webinar, but you will be able to put your questions into the chat box. So we'll just give you all a few minutes. I hope that we've maybe addressed some of the questions that you may have had. But if there is anything, please do use this opportunity while you're here with, the team, because these guys, they've literally, they've all been through exactly what you're going through right now. They've lived it, breathed it, experienced it, gone through the OSCE, settled, brought their families over. So these are really going to be a great source of information if you do have questions. Please don't be shy. Not seeing any. Okay, we have a question from Thelina. Thank you, Thelina. Is there any difference between various kinds of trust?
Can I answer that? So we class ourselves as an NHS family. So there is a lot of close working between all of the trusts. The trusts are based on the area which you live. So in each area, you will have a different trust that's responsible for the NHS care. But we pride ourselves in collaborative working. So there are, and some trusts will have different focuses on certain things. Our trust has a massive focus on internationally educated nursing. So we put a lot of resources into that because we can see the benefits of having internationally educated nurses. Some trusts might be bigger than others, so they might be able to provide different services to what other trusts can. For example, some of them have the major trauma units, the major trauma centres. Some of them might specialise in paediatrics a little bit more. But the general basis of the trust is all to work together in harmony and to share knowledge and to share experiences to make the NHS better as a whole. It's based on your location. Now, the benefit of Northern Lincolnshire and Gould Foundation Trust, from what the things I've been fed back for, is things like the house prices, and the fact that the house prices in the UK are a lot cheaper in our area, because we're a bit further up north, which is can be quite beneficial for internationally educated nurses. Like I say, we put on a big emphasis on our internationally educated nurses and have won awards because of that. We're also, I would say, one of the smaller trusts, so we're split over 3 hospitals, Scunthorpe, Grimsby and Goole. But because of that, we're all we are like our own little family, aren't we? And we all know each other, so we can provide quite a supportive environment in that way. Some of the bigger trusts maybe have a lot more employees, and it's not quite so. I don't know how to describe it. It's just, yeah.
Closely oriented. So
We're quite
closely
close.
attached.
Everybody seems to know everybody in our trust. We have got a good relationship with each other. So yeah, it's just about you doing the research into your trust and seeing if it aligns with your values. Our values are kindness, courage, and respect. We very closely align to them, both in we expect our employees to show kindness, courage, and respect, and we expect that shown to our employees as well. So that's the main differences, really. I don't know if anybody else wants to add anything to that.
Yeah, I think that pretty much covered it, didn't it, really? Yeah. You're welcome.
Could I just say, Carl was just mentioned one other difference we have
Yeah.
with trust.
I think one of the difference I've noticed as part of the of NLAG is that the OSCE support is really way much better compared to the other trust. Based on what my friends are saying from the other trust, because our OSCE training, we are trying to provide all the resources that we can actually provide to you guys. Unlike in other trusts, I'm not saying that the other trusts are bad though, but as based on what my friends are saying, their OSCE training was quite different because they're just giving the micro criteria and that's it. You have to do it by yourselves. Where in our trust, Michael and Trish will be there for you every step of the way, for you to pass the OSCE.
Anybody have any more questions before we end the webinar today? Well, of course, if you do have questions that you think of after this session, you know how to get in contact with us. And if you are in the Facebook group, please put your questions in there as well, and I can answer them, or you can come to me. What I will just do, for anybody who's not yet in our Facebook group, I'm just going to copy the link here and paste it. So we've created a Facebook group, which is for all of our international nurses and midwives who have either joined us or thinking about joining us. And it's a really great place where it just acts as a source of information, really. So this webinar, for example, the recording will be posted in there. If you want to talk to any of the staff who have already joined us, they are also in the group, so they can share first-hand experiences with you. And, you know, you can also contact us on our website, which is just Join NLAG. I'll pop that in as well. So the Join NLAG, joinnlag.co.uk. If you want to get in contact with us, there is a form there that you can submit, and that will come straight through to our team, the recruitment team, if you've got any sort of more questions. But I hope that today has really sort of served you well, in the sense of, you know, giving you that bit more information, painted a very kind of realistic picture of what coming over to the UK looks like as a nurse. And I just want to say, you know, a very big thanks to Trish, Michael and Carl for their time as well. So yes, thank you from my side, and thanks to everybody for taking their time.
Thanks to you for organising all of the webinars that you're doing. I know you're working very hard, Shaunad, so we appreciate that, because it helps to give us lots of new candidates to support. So thank you.
Yeah, brilliant. Well, I think that's it. I think we don't have any more questions. So we've obviously done a great job. We've obviously given everybody everything they need. And I think, you know, for anybody who's just listening, before I sign off, the next one that we are planning to do is actually going to be, we're going to turn it around, and the question will be, what does an NHS patient look like? That will be the next webinar. There'll be more information on that, but that's just going to touch on, you know, the differences of what patients look like, which again is going to be very different to some of the patients in your home countries. So that will be the next one. So watch this space for the next one. And yeah, thanks again, everybody. Bye.